How come I can't choose a virtual background?
I think you have to download them.
We are ready. We're live now.
Okay. I guess
I heard a dog.
It's like it's a year ago.
Way to run a meeting, folks. Okay, let's call it to order.
City Council Member, Agency Director, Authority Member Doris,
Here.
Molly,
Present.
Mann, Vice Mayor, Vice Chair Chris,
Present.
Mayor Chair Paris.
I'm here.
We have a quorum.
Thank you. Who's doing the invocation tonight? Listen, if ever we need prayer, it's this week. Daryl?
Father, we thank you right now. We ask right now, God, that you continue to help us, lead us in this time of pandemic, in time of surging sickness. God, we pray that you continue to give the doctors knowledge, give leadership knowledge, God, of what to do. We pray right now for complete healing. We pray right now that you would just lead and guide us to keep life as normal as possible. We thank you right now that you are the God of everything. We ask right now, God, that you continue to just bless us. Allow us, God, to make the right decisions at the right times. In Jesus' name we pray. Amen.
Amen.
Thank you.
Recording in progress.
Okay, let's hear from our deputy mayors.
I'm sharing my screen. Can everyone see that?
Yes.
Yes.
Okay, great. Let me pull into full screen. So we've been busy this past week. Things have gotten really crazy at both hospitals. But I'll start with the usual numbers. This is what's happening in the world. As you can see, the 7-day average spike is substantial. A lot of cases throughout the world, over 2 million cases per day, 300 million cases total. The 2 weeks is a 200% increase as well. Deaths have also actually have dropped. Despite the increase in cases, the deaths really have remained favorably flat or dropping. Where are the hot cases? As you can see, North America, the United States and Canada, parts of South America, and big time in Western Europe. England, Paris, they're all on the verge of shutdown. South Africa here at the tip, down in Africa, was purple about last month, but now they are in the lighter range. And so they're basically finished with their Omicron variant surge while we are at the height of it. As you can see here, this is the South Africa's Omicron curve. And they basically had 3 curves in 2021. The January, the Delta one back in the summer, and then the recent one, December, January. And as you can see, the orange line is the number of cases. And if you could hear, you can see the spike. That's very substantial, even more than their Delta spike. But what's nice is that the purple line, light purple line, is hospitalization, and the dark purple line is deaths. And as you can see, there's less hospitalization and less deaths compared to the substantial spike that they saw. When you go look at Delta, when they had their Delta surge, the orange spike, the light purple hospitalization spike, and the death spike were pretty much clustered together. And so the good news is hopefully we can see the same thing in the United States, that despite the substantial increase in cases, we have less hospitalization and less deaths. And that's South Africa's Omicron wave. So now going back to the United States, here the graph shows the increase in substantially high increase in cases in the past 7 days. Hospitalizations are increasing, but deaths are really not there yet. But recall, deaths usually follow cases 3 weeks later. And the daily average is over 600,000 a day. Positive tests have increased, hospitalizations are increasing, and deaths are also slowly increasing. When you look at locations where this is occurring, it's pretty much across the entire United States. Maybe parts of some states are spared a little bit, but for the most part, most of the United States and the southern part, LA is here. Basically, half of California, the southern half is pretty much in the midst of a huge surge. I'm trying to go forward. Kind of stuck. Hang on.
I'll just say while you're working on this that the mean age in South Africa is 28 years old, where in the United States it's 39. So it's a little hard to make direct comparisons about what our experience is going to likely be for hospitalizations and deaths. Anyways, there may be differences.
Yes, they are less vaccinated than we are, and so maybe our counts would be different. This is a map of corona in the United States currently. Right now, as you can see, the orange line is the number of cases, and it's really, really high. But the hospitalization graph and the death graph is still favorably low enough. However, the number of hospitalizations are now catching up to when we had the Delta wave, and hence we are super busy in our hospitals these days. The CDC tracks the Omicron cases. Maybe 2 weeks ago when I presented, we were like about here. But the purple box is now Omicron. It's basically 95% of the cases in the United States at this point. And basically, it's virtually all Omicron at this point. Here in Southern California, we are still, here in California, we're facing the same spike as the rest of the country and the world. The cases have increased 4 times, 400%. Hospitalizations increasing 130%. Deaths are following as well. And the map tells us that LA County is the most purple, 200 plus cases per 100,000, and most of Southern California going through the same surge. Here's LA County, the 7-day average, again, very high spike. Hospitalizations increased, positivity test, but deaths are really still lower than the Delta wave. We are now in the purple range, beginning towards around the week of Christmas, and we're basically going forward. Compared to the last spike, it was basically eight weeks of it. We are probably week 3 into it, so we should anticipate 4 to 5 weeks more of this spike. Deaths are relatively still low. Hospitalizations are high. Mortality rate very similar to the previous waves. Thank you, Jason's team, for providing this graph. But this is Lancaster's cases. It's basically very, very high, a lot higher than January of last year. How,ever, our deaths are still hovering on the low range, but remains to be seen. This map tells us by coloration where the heavy cases are: the Antelope Valley, Castaic, San Fernando Valley, and then downtown LA, Century City area, and parts of East LA as well, where all the cases are. So just a little bit about Omicron. If you recall, there's got about 36 amino acid changes, and it's changed in the spike protein. And the spike protein is what the virus needs to infect the cells in the human body. Studies are now coming out all over the world: England, China, Hong Kong, South Africa, many are seeing that this virus prefers the nose and the cells in the nose and prefers the cells in the bronchus. So here, for example, the green line, the green box is the original virus back in 2019. The orange box is Delta, and Omicron is the blue box. And if you look at the cells that are detected in the bronchus, the main airway, it's 70 times more affinity for bronchus cells than Delta. In the lung, it is 10 times less affinity than the original and also less than Delta. So apparently this Omicron infection virus prefers the nasopharynx and the bronchus rather than the lung. So that's why we're not seeing that many admissions, at least in South Africa and here as well. That is less lethal and less requirement of hospitalization and death. Multiple studies using animals and models, hamster models and laboratory models out of many places, United States, UK, Belgium, Japan, they're all showing that the key findings is that there's decreased lung infectivity, again, markedly decreased. It doesn't go after the lung, it goes after the upper airways. And so in a way, it's good, but it's just much more contagious than Delta even. So what's the national forecast? Predictions for hospital admissions will continue to go up. For California, predictions also continuing to go up, at least until the next several weeks. And concomitant with that, national prediction is the weekly death rates will also climb in the United States and also in California, based on the number of cases that we are seeing now. The vaccines still work. Vaccines still prevent admissions to the hospital 80th, 90th percentile. Currently, United States, we are 62% fully vaccinated. Fully vaccinated means you've got 2 doses, dose 1 and dose 2. They have not given us information regarding the 3rd dose, the booster yet, but so far 62% vaccinated. If we continue this rate, we probably will reach the 75th percentile sometime in October. And each county is different. Just a little bit more information regarding vaccines and immunity. The red line is the AstraZeneca vaccine, the J&J vaccines, orange line, and the blue and the green lines are Moderna and Pfizer. And as you can see, if you vaccinate patients at week 0 by the 125 days, the immunity goes from 90 down to 80. For Pfizer, 90 down to 60 or less than 60, and so on. So when you see the patients have received 2 doses, if they received by week 25, the patients with 2 doses have increased their hospitalization by 52%. But if they get that booster 2 weeks later, after the booster, hospitalizations against hospitalization is now 88%. So that's why this data tells us that if you get the booster, you have a better chance of not getting hospitalization than even if you've received a full 2-week vaccination course. So again, encouraging people to get their booster shot. Going to LA County website vaccination dashboard, year to date, the LA County is 67% fully vaccinated and 25% with the booster dose. And then breaks down on various age groups. But the most encouraging is that up to 89% of the patients over age 65 have received the vaccination, and 54% also received the booster. So we protected this most vulnerable group so far, and that's really encouraging. As you can see, 97% received at least 1 dose in LA County. Going to our specifics, our city of Lancaster and nearby city of Plumdale Currently, we are at a little bit above 60% in terms of vaccination. And over at Palmdale, they are closer to 70%. There's a gap between us and the rest of LA County, and that makes us vulnerable based on the data that I presented slides earlier. And that's all I have at this moment.
Tell us about the shortage of treatment.
Okay, so currently there is a drug I presented several times before on here, the Paxlovid, which is the oral version antiviral, and it's made by Pfizer. And it's a 5-day course of treatment, and it's really difficult to get at this point. There's basically, the United States releases about 30,000 courses a day. And right now, we just don't have enough of it in the Antelope Valley. And based on the cases that we're having, really, it's not easy to get these courses. So we've been working with the people who are distributing it. I talked to 2 physicians today. Dr. Kieran is in charge of distributing Paxlovid, and she said that she received about 500 courses. I'm sorry, 3,000 courses, and she sent it out to 50 sites. And in the Antelope Valley High Desert Medical Group, HDRC, Kaiser, and Altadena, and 1 CVS in Lancaster received the distribution. And it's the only one in Lancaster CVS is 2006 West Avenue J. And last week, they received 140 courses. This week, they're about to receive another 55 courses. Now, I asked her what determines where the distributions are. She said that they are looking at the number of cases, and that SPA 1, which we are in SPA 1, is receiving its fair share of oral antiviral drugs. Rite Aid has it not yet submitted the pharmacy that it wants to receive from. But if we want other pharmacies or clinics to get it, we should go online and basically put in the application, and they will review and approve. I mentioned with her that when the vaccines came out last year, there was a mismatch. We had a lot of cases, but we didn't have enough vaccines. I just wanted her to be aware that hopefully the distribution of medications to prevent infections, prevent hospitalization will be better this time. She said, yes, they are going to be transparent about it. And she will send me a link to track where the distributions are. And then Jason also has been working with Dr. Kieran. I don't know if Jason, you have any comment regarding that?
Yeah, we were working with the supervisor's office, and then also with the other drug, which is an IV drug that goes directly to the hospital. It's an inpatient service. So the pills that Dr. Trong mentioned are outpatient. So this is prescribed by your doctor. You go to the pharmacy and get it. The other drug is an intravenous drug, and that is requested through the hospital because it's an inpatient service. It's a much different acuity from a patient perspective. And then I know Dr. Stock is on top of that as relates to ordering that from the hospital.
Right. So Trovimab is a monoclonal antibody that's effective against Omicron, and the 2 drugs that we're using earlier are effective against Delta, but not Omicron. And so the federal government has swapped out Regeneron and Bamlanivimab for the new medication. It'll be given through the emergency department for those people that meet criteria for high risk if they get COVID. So it still is best thing you could still do is get vaccinated. And if you're eligible to get boosted, and to do the same for your children, to mask with the best mask you can and distance. But if you do get sick, if you get a sore throat around this time of year, along with other symptoms, you may have COVID. And if again, it could be up to 40% of the population is going to get it right now. So, if you need a test, we'll talk about that. We have testing available. If you're sick, you should see your doctor. If you're short of breath or you're having serious problems, come to the hospital.
Larry, Dr. Stock, is the Sotorumab, sorry, has that one arrived yet, or are we still waiting on that one?
It should arrive any day now. We are we're within a day or two probably of its arrival. So
Yes, I spoke with the chief of pharmacy at Antelope Valley Hospital, Mr. Ross Bauman. He did submit the request, and the physician that's supplying it says that they will meet the request. And it's based on how much can be given in one sitting and all that. So they're going to match what AV Hospital has requested.
That's great.
Yeah. But better drug.
Yesterday, you guys were telling me something different. Yesterday, you were telling me we were out.
we are.
Well, we are out.
We are out.
We are waiting.
And the reason I'm bringing that up is because this morning, Congressman Garcia called me with Congressman Kevin McCarthy, who's the House Minority Leader, and the California Secretary of Health. And the reason I'm bringing that up is Congressman Garcia is the angel today for the Antelope Valley. I mean, within hours, these calls were being made about getting this medication to our people. And I want everybody to be aware of that. That was a superhuman effort. And it's not unfair, it's fair. The reason it's fair is because we have the highest number of people with heart disease, with respiratory disease, and with diabetes in the entire county of Los Angeles. We have 50% Latino population, which is a population that is just getting hammered with this disease. And and unfortunately, for whatever reason, our vaccination numbers are deplorable. Our people are sitting ducks if we don't have this medication. And for those two, and then the secretary to step up like that as rapidly as they did, I've never seen anything like it. I mean, it was immediate. I'm just overwhelmed by it. And I just hope people in Lancaster recognize what a significant thing that Congressman Garcia and McCarthy did.
Well, thank you, Mayor.
It was also bipartisanship in action. I mean, you got a Democratic secretary working with the Republican leadership to solve this problem. It was truly beautiful to behold in many respects.
What you did today was incredibly important, Mayor, because while we may have access to medications in pharmacies and in the hospital, it may not be in adequate numbers to meet the demand. So what you're doing is ensuring for those people that are vulnerable to having bad outcomes to be able to get early treatment if they do get sick and need it. So thank you.
Yeah, we don't have enough. We need.
You put a team on contacting these pharmacies and tell them to get their request in tomorrow to put in their requests. It's crazy that we might be without this medication because somebody didn't fill out a form.
There are only 40% of the population of Lancaster are unvaccinated. That's about 60,000 people. If even if the penetration is 50%, you still need 30,000 doses. Through the next 5 to 6 weeks. We only receive 140 doses. We need 30,000. So that's why it's an urgency that, and I appreciate that you reached out to the leadership in California to get the doses we need. Thank you.
Well, the reach out was easy. It was them making it happen, which was truly remarkable. I mean, they will forever be heroes to me, and they should be to all of us.
Absolutely.
There's also the testing issue. There's a shortage of tests nationally, and I'm just glad to hear that we have at least enough to test the people that wanted it. But the supply may not be around, so we could either order more ahead or not. There's also so.
And Tim, you may want to touch on the testing and how availability it is and what's going on over the testing site.
Absolutely. So through the generosity and I don't know, the fighting for the people of the AV that Mayor Paris has done, testing is open to everyone in the AV. And both Lancaster and Palmdale residents now can be tested without having to pay up front, without having to pay, which is fantastic. Cities are taking care of that. At the Jethawks testing site. Now that site is running a symptomatic, preferably a symptomatic test. It tests for SARS-CoV-2 antigens as well as influenza A and influenza B. The test itself takes 15 minutes to run, and the results will be emailed within hopefully about 2 hours. Eventually, the goal is to ideally open up a screening test site as well for those individuals whose employer or school or travel company or healthcare provider that's going to do a medical procedure that requests a test result. Ideally, very shortly here, we'll have those tests open as well, which will only test for the SARS-CoV-2 antigen, which is the virus that causes COVID. I know that there has been a lot on Facebook about the availability of tests, and we are working on ramping that up. It unfortunately has to go stepwise so that we don't completely overwhelm the system and just collapse the whole thing. It's taking a little bit of time. However, we've increased the number of appointments available since last week, and the goal is to continue to increase that until we meet the demand. In the meantime, though, if you are in dire need of a test and there's no appointment available same day, you are welcome to call the city and see about getting a same day appointment made, and or drive over to Jethawks, where the test site staff can either, if they have available spots left for the day, they can add you on for the day. And if they don't have a spot for that day, they can assist you in getting an add-on walk-in type spot for the next day. So there's no reason to feel like just because the appointments are all booked up for the next 5 days that you can't get a test at all for the next 5 days at Jethawks. There's no reason that that should be happening. We should be able to accommodate everyone who truly needs a test.
Good, thank you. I think we're one of the few communities that are giving free tests. That's quite an effort you're doing. Thank you.
And I do just want to point of clarification. These are truly free tests. Everyone else that is providing tests with no charge to the individual being tested, all of those sites, as far as I'm aware, are billing your insurance. And if you don't have insurance, then they're being paid by the government, the federal government, through the emergency funds. But this test is a test that is truly free to the people of Lancaster and Palmdale by our city government, rather than our insurance company or some other overarching government.
Now, there's a reason we do that. And could one of the doctors explain to the people why it's essential they get testing if they think they're exposed?
I'd be happy to.
Okay, good.
That's okay.
Go ahead.
You're running the site. Go ahead.
So one of the most important things when you've been exposed, if you can, just stay at home for the 10 days, 5 days, 10 days, make sure you have no symptoms, and then go back to work with your mask on and maintaining some social distance. If you have to be out in public, it's really important to get a test, because for those who've been fully vaccinated and boosted, you may have the virus and not be symptomatic, which is good news for you, but that doesn't mean that you can't spread it. And if you've had COVID before, same thing is possible. It's also possible that before your symptoms develop, that you could share your virus with others, which we don't want to do. So the biggest purpose of the testing site is to hopefully cut way down on that transmission, help people get back to work, stay in school, get back to school, be able to have medical procedures done without having to wait until this whole thing is over, because we don't have a timeline on that, but also while being as safe as possible. Now, the test isn't 100%. You could test negative today and positive in a week, positive in 2 days, but it is better than nothing.
Good. Thank
Well
you.
said. I agree.
Is the county, has the county required proof of vaccination to get into public facilities?
Restaurants for sure. If you go to a restaurant, they will require proof. You have to show the certificate or the QR code to enter.
Is that countywide or just LA City?
But this was San Fernando Valley. When I went to dinner the other day, I had to show my card, my QR card.
Yeah, that might be just LA City. I know LA County has changed some of the protocols for larger events. So events that are over 500 people are required vaccinations. So that includes LPAC and some of the other events we may put on. So we've changed those protocols as well for city operation. And we track that on a daily basis on what those changes are coming through. And they have made changes since the start of the peak.
You know, I don't want us to return. I think that initially in this virus, we overreacted in some ways. There doesn't seem to be a huge threat when people are outside if they're not closely congregated. Also the threat to people who are vaccinated is minimal, right? But I need to know from you guys when we need to tighten things down. And what I don't want is for our inaction to result in any other person dying that doesn't need to. And I mean, that's the goal. We don't want one person to die needlessly. And so I'm going to listen to you. We're still in a state of emergency. If you tell us that we need to require proof of vaccination for every public facility, that's what we'll do. The council will be notified immediately. If we have to have an emergency meeting, we'll have one. If we don't need to have one, we won't. But we're not going to do anything that isn't absolutely essential. But I absolutely need you guys on the phone to us. As soon as if we see the hospital breaking down, meaning overrun, we need to act, and we will act. And you know, quite frankly, I hope people understand, but if they don't, they don't. All right.
Mayor, I would add that right now, I think we're doing fine, but I think everyone in the city needs to make their own personal risk assessment, meaning if you're fully vaccinated and boosted, if you're boost eligible, you're in real good shape for not getting hospitalized or dying from this, as long as you have an intact immune system. Okay, that's principle number one. If you want to avoid infection, do all the other things: wear a mask, distance, avoid crowds, and you'll be in real good shape. This is contagious and it is airborne. If you've decided not to get vaccinated or not get boosted or not vaccinate or boost family members, those people are at risk not only for infection if they don't mask a distance, but also for some serious disease and possibly hospitalization. Those people have a much higher risk for a bad outcome, and they should accordingly take much greater precautions not to get the infection.
Now, a bad outcome means dead, doesn't it?
Yes.
Thank you. I mean, let's not sugarcoat this.
I'm not. Yeah. Hospitalizations and death, just like Delta.
And that's after you spend a week with a tube stuck down your throat.
Actually, it may be after spending a month with the tube down your throat. Yeah. So people are not dying quickly there. So
right. Treatments now that will prolong your, will reduce the chance of you dying quicker. We have remdesivir, and we have better techniques of ventilation. We have a antiviral, so it does reduce. Gives you more of a chance. But sometimes once your lungs have reached fibrosis, which is scarring, it's hard to ventilate you, and it's not a good outcome.
To that point, Dr. Trong, too, I want to reiterate the importance of reaching out to your doctor should you get sick, whatever your symptoms. rather than going in, please don't just walk into your doctor's office if you're sick and coughing. Call them first and make sure that you're following whatever the protocols are. But, early treatment, whether it's an IV infusion through the ER or oral Paxlovid, or something else, whatever your doctor's doing for you, early treatment has been shown to really, really help to, one, keep you out of the hospital, two, keep you off a ventilator, prevent that fibrosis in your lungs. And so please don't wait. Don't wait a week, 10 days, 2 weeks, 3 weeks before you call your doctor.
Just so people are aware, fibrosis means scars. It's not going to go away. Once you get it, you get it. It's there forever. If you survive, you're going to have scarred up lungs, and life is not pretty that way.
No,
That's
correct.
And if you're trying to equate early treatment with prevention through vaccination, you're mistaken as well. The treatment, prevention is always better. Treatment is limited by not only the supply, but many people do not qualify due to the side effects of the medications interacting with some of the other medicines they're already required to take. So the Paxlovid is not for everyone. It's not for children, and it's not for people on multiple different medications, that people are commonly on. So we have to do a very careful risk profile before we prescribe it.
Okay. The other thing I'd like to point out is that if you don't have an N95 mask, we have them at the city. We're giving them out packs of 5. Just come to the city, and the staff will help you with that. Explain why the N95 is important, and also I'd like to remind people of the difference. The N95 has the straps that go behind your head. They're not the ear straps. And the reason that, and that's a pain in the butt. I know I don't like them either, but it creates a better seal. And that's why the N95s are not behind the ears. Now, any mask is better than no mask, but this thing is so contagious that's why they're recommending the N95.
Right. If you're wearing a bandana right now, it's not good enough. If you're wearing a scarf or a piece of cloth, it's not good enough. Maybe stylish, but not going to work. A surgical mask is better than all those. However, better than a surgical mask is either a KN95 or an N95. This is an airborne virus, and it's very contagious. So the 6-foot rule really doesn't apply much anymore. You can throw that out the window. This thing floats through the air, and so if you're inside a room with somebody who's got it and you're not wearing a mask, there's a chance you're going to catch it, especially if you're anywhere near them or anywhere breathing, in a poorly ventilated room. The N95 or the KN95 has a special filtered thing to filter out almost every particle of every size down to very, very virus-sized things, 95% of the time. So I think we need to, you want to wear the best mask you can possibly get. These things are available through the city. They're available through the internet. You can order them. And if you're going to wear a mask anyways, wear the best mask you can.
Yeah, and we do have ample supply, and we are advertising that you're welcome to come to City Hall and get some, and we've actually ordered more.
Okay, thank you, you guys. I think you're doing a superhuman job here. I appreciate it. So does the city. Despite the garbage you read on Facebook, I think 98% of the people in the city are very appreciative of everything that's being done. And we will keep waging this fight until it's over, and it will eventually be over, and we will eventually prevail. It gets really, I know how depressing it gets when, all of a sudden we were free, and, now I'm locked up in this room. I get it. I get it. So are there any speaker cards?
At this time, anyone wishing to comment on ED1, please press *9. I will announce the last 4 digits of your calling number when it is your turn to speak. Please state your name and eliminate any background noise. Individual speakers are limited to 3 minutes each. Please press *9 at this time if you wish to comment on ED1. No speakers for ED1.
That's surprising. Thank you. Okay, any discussion, council, or have we discussed it to the enough? Is there a
Motion
motion?
to approve ED 1, 1, 2, 3, and 4.
I second that.
Need a second?
I second that.
Okay, thank you. Let's vote.
City Council Member, Agency Director, Authority Member Doris,
Aye.
Molly,
Aye.
Vice Mayor Chris,
Yes.
Mayor Paris.
Aye. Passes unanimously with Councilman Mann. Did we excuse his absence?
You did not yet.
Okay, with Councilman Mann absent, and is there a motion to excuse his absence?
Motion to excuse Ken Mann's absence.
Is there a second?
I'll second it.
City-
Let's vote.
City Council Member, Agency Director, Authority Member Doris,
Aye.
Molly,
Aye.
Vice Mayor Chris,
Yes.
Mayor Paris.
Aye. Passes unanimously. We now have SANB1. Is George Harris around? George, did you leave your name up and you left your post? Oh, I am shocked.
Oh.
I am here. I do have to apologize for not turning my camera on. I had surgery last Monday, so I'm not exactly dressed appropriately since I'm recovering, but I am.
Enough information, George.
All right, got it. Thank you. All right, so moving on, what you have under SANB1 is just the recognized obligation payment schedule for the period of July 1, 22 through June 30, 23 for our successor agency annual recognized obligation approval. Once approved, it will be sent over to the county to be approved at their level. And then we meet our requirements for the year, and then it'll be reviewed once again prior to the end of the year for the second year submittal. So with that, I'm available to answer any questions you may have.
Any questions? Are there any speakers for SBNB2?
At this,
NB1.
Yeah. Right.
Oh, Rex, can you make it for NB 1 and 2?
Yeah, let's do that. Is your report for both?
The report will cover both. The first is the successor agency approval and the administrative budget. I apologize. And then NB2 is the recognized obligation payment schedule, which is the actual payment of our debt out of those particular funds. I apologize for any confusion there.
My fault. Okay, thank you. Andrea, are there any speakers for either one of those?
at this time, anyone wish to comment on SANB1 or SANB2, please press star 9. I will announce the last 4 digits of your calling number when it is your turn to speak. Please state your name and eliminate any background noise. Individual speakers are limited to 3 minutes each. Please press star 9 at this time if you wish to comment on SANB1 or SANB2. No speakers at this time.
Thank you. Is there a motion?
Motion to approve SANB1, adopting resolution SA01-22 and SANB2, resolution SA02-22.
For a second?
I'll second.
Go ahead.
Please call the roll.
City Council Member, Agency Director, Authority Member Doris,
Aye.
Molly,
Aye.
Vice Mayor Chris,
Yes.
Mayor Paris.
Yes. It passes unanimously. Moving on to the consent calendar. Are there any items to be removed? Hearing none. Are there any speakers for the consent calendar?
At this time, anyone wishing to comment on the consent calendar, please press star 9. I will announce the last 4 digits of your calling number when it is your turn to speak. Please state your name and eliminate any background noise. Individual speakers are limited to 3 minutes each. Please press star 9 at this time if you wish to comment on any item listed on the consent calendar. No speakers at this time.
Thank you. Is there a motion to approve the consent calendar?
Motion to approve the consent calendar as comprised.
Is there a second?
I second that.
Let's vote. Call the roll, please.
City Council Member, Agency Director, Authority Member Doris,
Aye.
Molly,
Aye.
Vice Mayor Christ,
Yes.
Mayor Paris.
Yes, passes unanimously. Moving on to new business item 1. Shannon Dow, I hear you're giving away money again.
At your brilliant direction, Mayor Paris. So, Mayor Paris, Vice Mayor Christ, council members, I'm pleased to present you with the opportunity to assist a number of our local small businesses. As you'll recall, in March of 2020, the council acted very quickly, and within just days of the activation of the EOC, we launched the Small Business Recovery Business Loan Program. That enabled us to get money into the pockets of small businesses who were in a catastrophic situation in terms of cash flow. Very quickly, as the situation evolved and businesses were labeled as essential and non-essential, there kind of arose a divide between those businesses. So some were essential and were able to continue operating, although they did have some cash flow issues at first, while others were labeled non-essential and suffered for over a year from various closures that LA County imposed upon them. So with that, they were enabled to apply for up to $20,000 through our program, which was originally funded through the general fund. So we were able to fund 37 businesses total, valued at a total of $700,000. 31 of these were non-essential, and they were among the hardest hit businesses. So these included restaurants, entertainment venues, salons, things like that that faced months and months of closures, were forced to lay people off or reduce their hours. And they really struggled to stay afloat. LA County was actually the first in the nation for the loss of small businesses and the associated jobs with those. At the last meeting, council recognized the kind of crisis mode that some of these businesses are still in as they look to come out of that hole that was created and face the new surge that is coming forward. And the council directed us to explore avenues for forgiveness of these loans. So that's what we're proposing tonight, is the forgiveness of all non-essential businesses and all of that funding. So that's approximately $560,000. And again, that originally came from the general fund, but the federal ARPA money will cover that and reimburse the city. With that, I'm available for any questions.
So you're giving away $750,000, is that right?
It's just $500,000.
$500,000.
Yes, the essential businesses have actually already begun to repay, and many have communicated that they do not need the extra assistance. So they are repaying. So this would only be the non-essential.
Okay, great.
And Shannon's not giving it away. You guys will be.
Yeah, well, I kind of knew that, but I was kind of hoping to, flip it to her. Shannon, you have done an amazing job through this crisis. I mean, absolutely incredible. The amount of money you were able to find, beg, borrow, and steal and put back into this economy was truly magnificent. I wish there was some way we could celebrate just how magnificent you are, because you truly are.
Well,
and
thank you.
At least from the mayor, I want you to know I will never forget this. Just how, people, enough, I guess. You left me speechless, and that is a rare event.
Well,
thank you.
I thank you, and we couldn't do anything without the council and the incredible team that we have.
Yeah, I know you have to say that, but you were absolutely brilliant in how you managed this.
Thank you.
So do we got to vote? I guess we got to vote. Is there a motion?
Speaker,
Whoever makes. the
Public
motion,
comment, please.
You're the one who's actually giving the money. Oh, I gotta have speakers, right? Are there
At this- At this time, anyone wishing to come in on NB1, please press *9. I will announce the last 4 digits of your calling number when it is your turn to speak. Please state your name and eliminate any background noise. Individual speakers are limited to 3 minutes each. Please press *9 at this time if you wish to come in on NB1. Caller with the last 4 digits. Wait, I think you changed your mind, so never mind. If that's the case, no speakers. Well, okay. So caller with the last 4 digits, 9284. Please press *6 to unmute yourself. State your name and you may begin speaking. Caller with the last 4 digits, 9284. Please press *6 at this time to unmute yourself.
Good evening. Can you hear me okay?
Yes, we can. You may proceed.
Okay. Hi. My name is Elise Kaby, and I'm co-owner of Somera VR, and I'm just calling to express our appreciation for your consideration of new business item number 1, the Business Recovery Loan Program, and also thank Shannon Dow and Ben Rainiak in particular for their administrative efforts on behalf of those who were deemed non-essential and shut down for so long. Obviously, the financial impact was utterly devastating, but this loan forgiveness program will truly make a difference in blunting some of the worst pain of the shutdown. So thank you all very much for your consideration. It's greatly appreciated.
Thank you for that.
Thank
you. Any other speakers?
No other speakers at this time.
Okay, is there a motion?
motion to approve NB1, 1 and 2.
Now, Marvin, you do realize that means you gave away the money.
It actually means we found the money to give away.
That's true. That's true. Is there a second?
I'll second it.
Let's vote. Can you call the roll, please?
City Council Member, Agency Director, Authority Member Doris.
Aye.
Molly.
Yes.
Vice Mayor Christ.
Yes.
Mayor Paris.
Yes, passes unanimously. Thank you. Okay, moving on to the council agenda. Oh, okay, this is the LC committee. So I guess we have to have public comment before we can swear in. Mr. Bruce?
Yes, so we need to take public comment on CA1 and CA2. We can do that together.
Okay, let's do that.
At this time, anyone wishing to come in on CA1 or CA2, please press *9. I will announce the last 4 digits of your calling number when it is your turn to speak. Please state your name and eliminate any background noise. Individual speakers are limited to 3 minutes each. Please press *9 at this time if you wish to comment on CA1 or CA2. No speakers at this time.
Hearing none. Is Devin Burden available so we can swear him in now?
Yes, I am.
Oh, great. Hi, Devin. How are you?
I'm well, Mayor. How are you?
Good. Let me see if I can figure out how to do this.
Mr. Mayor, it would be appropriate to vote before we swear him in.
Oh. Okay.
I will second the mayor's nomination.
So I'm nominating and I need a second for that, right?
I will second.
Vice Mayor Chris seconded.
Okay, so let's call the roll.
And this is on CA1 and CA2?
Yes.
Okay. Is that correct, Vice Mayor Chris?
Yes.
Thank you.
See how she walks us through that? I mean, she.
So thorough, so thorough.
City Council Member, Agency Director, Authority Member Doris.
Yes.
Molly.
Yes.
Vice Mayor Chris.
Yes.
Mayor Paris.
Yes. Well, Devin, congratulations. You're now on the LC committee.
Thank you.
Spend that money wisely. An absolute fortune.
And it passed unanimously.
I appreciate that. Thank you all.
That money can change the city incredibly if we do it right. So, if you'll repeat after me. I, Devin
I,
Burton,
Devin Burden,
do solemnly swear that I will support and defend
do solemnly swear that I will support and defend
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies,
against all enemies,
foreign and domestic,
foreign and domestic,
that I will bear true faith
that I will bear true faith
and allegiance
and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
that I take this obligation freely
that I take this obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion,
and that I will well
and that I will well
and faithfully discharge the duties upon which I am about to enter.
the duties upon which I am about to enter.
Congratulations, you're on the commission, or I guess it's a committee, yeah.
Thank you.
And
Thank you very much.
we hope to see you involved in city government for a long time.
I plan to. I appreciate the opportunity to serve.
Thank you. We'll sign all this and get it to you as soon as somebody figures out how we do that, okay?
Okay. No
And,
problem.
I'm sorry we couldn't do this in person, but I think that's about 3 or 4 weeks away before we can resume.
Understood. I'll still be around, God willing.
Thank you.
Thank you.
You're vaccinated, right?
Absolutely. And boosted.
Okay, thanks. Okay,
All right.
let's move on. Let me find my notes. Now
We're on council reports, Mayor Paris.
I'm sorry, what?
We're on council reports.
Okay, let's hear the council reports.
I'll start with ADA QMD. We did meet in December, and we found out that we were able to purchase all the electric equipment that Lowe's had in Southern California to supply our people with. So we're trying to get Lowe's from the entire state of California to make us a priority. People can still go in, get electric lawnmowers, electric chainsaws, electric blowers, garden equipment that's run electrically. And the AVA QMD will pay for a substantial portion of it.
You know, I really hope people take advantage of this because it's not going to be too long before the state's not going to allow those things to be serviced at all. And when they break, they break. This is an opportunity people should be all over. And Marvin, you guys did an incredible job making that possible.
If everyone keeps in mind, when they take one lawnmower out, one lawnmower is the equivalent of 7 motor vehicles. So it's a huge amount that we're taking out. And with the numbers that they're showing with the ozone, it is incredible improvement in the air quality in the Antelope Valley.
You know, that's another thing we really got to get the word out on is who is on the air quality management board with you from the city?
Ken.
So you and Ken are on that, and then you and Daryl are on the AV Transportation Agency.
Me and Raj are.
You and Raj, you guys switched over the buses to electric buses, and now the pollution in the valley has dropped. Well, you tell them.
Well, in 2005, you're allowed 70 parts per billion. In 2003, there was 106 days that were over 70 parts per billion as far as ozone. In 2019, which was a year prior to the pandemic, because I don't want people thinking it's because of the pandemic, it went down to only 6 days. So we were having 106 days over the 70 parts per billion. And now we're only having 6 days over that, which should reduce our air quality from severe to a much better level, which will allow us much better availability to get businesses in here.
Yeah, that's the thing people don't understand. It's not only that we're going to live longer because we're not breathing all that stuff, but we're limited in how many new businesses can come in if the air quality is bad. And this was a huge, huge accomplishment. And Marvin, you and Raj need to be congratulated. I mean, no one else, I'm not aware of any other city that has accomplished that. It is truly remarkable. Thank you.
Well, we are doing it. And Rex, if I can put in a plug for Lancaster Choice Energy, because of Lancaster Choice Energy, any money that we make from that, we're also partnering with the AVA QMD to supplement the lawn equipment stuff for the city of Lancaster. So that the profitability of Lancaster Choice Energy does not go into the city coffers. It goes back to the community through those type of programs, which is it's a very good thing to do. The second thing is ABTA, we did a food giveaway. Jason, do you have a video on that?
Yeah, they'll get it propped up, I'm sure. They're doing it now.
I think Jason does that in his part of the show, Marvin.
I'm sure they're getting it. Sorry, my dog's saying hi.
Okay, going away. Okay, good.
This is actually an Antelope Valley event. It's sponsored by AVTA, City of Palmdale, City of Lancaster, but there's a lot of other people that put their hard work into it. Giving food out, giving turkeys out, giving toys out, giving bikes out. AV sheriffs are here, everything. It's a good day.
It also represents an effort between the cities to come together, work together in solving regional issues.
Now I see a lot of families coming in every car. There's kids in there, there are parents in there, and the elder people. Everybody's smiling.
There's no reason for anybody in the Antelope Valley not to have a great Christmas dinner.
Being in this community shows that we are community, that we are family. One of the employees just came out and asked if she could have a toy for her granddaughter. And we said, absolutely. And she stopped and talked to me for a few minutes about how much she loves working here at Antelope Valley Transit Authority because of the community feel, the family feel that we have here, and the outreach that we do in this community. Because again, these are our family, this is our town, this is our community.
Rex, what's nice about the giveaway is we not only partnered with the city of Palmdale, but we partnered with the unions, the IBEW, the Teamsters, and several other unions partnered with us to, they're the one that brought a huge amount of labor to the event. Viarta was very helpful in obtaining the turkeys for us. We supplied over 1,400 turkeys to everybody that came through. We serviced a little over 2,000 people. It was a great day for the Antelope Valley. It showed that we're all working together, and all these people for sure had a great Christmas because we gave them food, toys, and everything that they could want for or need.
The gift card.
Oh, and the gift card. We gave away probably 3,000 gift cards at that event alone. So.
It was great. Thank you. You know, I don't know about you guys, but I'm so proud of this city as it first. Okay, where are we? We've got all the council reports.
The only other thing I have is we had I was on a SCAG meeting, and
What SCAG is?
Southern California Agency for Governments. It's another transportation.
Sounded like a disease.
No, we don't need no more diseases, please, God. But we did have a lengthy agenda, but we probably didn't get past two parts of the agenda. And one of them was, I was really adamant about not making sure actually that we do not create toll lanes up here on the freeway. That's a consideration. And so myself, along with Santa Clarita area, we were very adamant about, you guys need to find other ways of opening up the freeways and spending money than taxing people that's already paying $5 a gallon on gas. Also, we talked about there's a bill coming that is working on, and we have to get with our elected officials on that. But we're trying to figure out if we can have more control over speed limits than just the 80%. If there's a certain amount going at a certain speed, they usually set it at that speed. Majority rules. And if the majority is speeding, then it almost seems like that's the rule. So trying to find something a little smarter, as you would say, Rex, than that. And lastly, yesterday I had a good meeting with Salva, the Hispanic organization that deals with community needs. And we really got into trying to talk to them about how to deal with the COVID pandemic in the Hispanic community, how to reach out to them. And they've been really diligent in trying to making sure that they're having the vaccination sites and getting out those shots and boosters. We also talked to them about some of the concerns about the vendors, street vendors that's been on the corners, and how we can communicate with them and get in a path in which they can get business license and do it the proper way, the right way. Instead of a lot of these vendors popping up, and it can be very dangerous for them and customers trying to eat the food that's on some of these dangerous, very busy corners. So we had a very productive meeting. So
thank you, Gary.
No problem.
Mayor Paris, we had a medical Main Street meeting also, but there's not much to report, but we are definitely getting closer to groundbreaking, but we have a few other meetings to probably go before we do that. So
good, thank you, Raj. That's $1 billion, right? I mean, when it's all said and done, that's going to be $1 billion investment in the community.
It's definitely going to be it's going to be like a piece of artwork in Lancaster once we're done.
Thank you. Okay, city manager.
Yes, sir. Thank you. A couple updates real quick on what we've got going on. One, I'd like to give a shout out to our communications team. We talked about COVID already. I don't want to rehash that conversation, but give a shout out to them. They're able to turn on a dime. They're out talking about Poppy Festival and events at LPAC and things we're doing. And then, when this happens, we're able to tell them, oh, we got to change. So you'll see that communications effort change. They do a fantastic job of it. A lot of the messaging is what you heard tonight from the doctors and created by the doctors. So you'll see some of that coming out through this peak, but want to give a shout out to them. They've done a fantastic job throughout this event, but also coordinating the regular stuff that we're trying to do as a city as well. Parks Department has also been busy. This weekend, the January 15th, we have MLK Day of Service. You can work through the Parks Department, look online how you can volunteer. We already have 200 volunteers who are going to be out serving the community working to make our community a better place. We also have Justice Sunday, which I know the council loves and enjoys. It's part of the MLK weekend honoring Martin Luther King, and that's where the youth come and do a play. I don't want to minimize it with naming it a play, but it is an event that is worthy of attendance, and that is going to be Sunday. That's at LPAC. We're deep in preparation right now for Poppy Festival, April 22nd to the 24th. There's going to be a little change in the Poppy Festival. It's in association with the fair. So we're partnering with the fairgrounds to do a much bigger event in conjunction with the fair and their facilities but also making it a statewide event. And you'll see some of our branding come out that identifies that as a California Poppy Festival. And so hopefully not only stimulate more activity, but get more acts and more things like that. So it'll be bigger and better this year, and in association with the fair, which has a long history of successful events at that site. We also have LPAC Justice Sunday. We mentioned the 21st. We have Ray on our mind, which is Ray Charles stories. The 23rd we have Quinteto Nuevo and the LPAC Foundation Speakeasy on the 28th. So all those are going to be masked events. We will have N95 masks for everybody to participate and wear the appropriate masks, those events. And then starting the 16th is actually vaccinated only per LA County rules. So staff has been set up systems to make that happen and put that into place. MOA has 2 exhibits starting April 17th. So come and participate out there. If any of you, those of you who've been to MOA, know that the team there works hard quarterly, if not more often, to change those exhibits. So come and support them and do that. They do a phenomenal job, and it's as always, it'll be a great event. Development Services, January 29th is doing a Recycle, which is a recycled bicycle program. Come participate in that. And of course, construction continues throughout the community. 1 note, 2 notes that we've had since our last meeting is Parks Department under Sonia's leadership was able to gain a $8 million grant for the refurbishment of a park. Some of that went out on our social media, but I don't think we shared with the council. And then just today or yesterday, we received a $24 million grant for transportation enhancements around the Avenue I and Sierra Highways or Sierra Highway bus routes, as well as Metrolink and some of the housing that's in our downtown area. So staff has been doing a yeoman's work in getting this additional money. That's on top of the federal funds we've received. That's on top of Measure LC. So we're going to have a busy year and busy couple years getting those projects on the ground. So kudos to staff. You already gave Shannon a shout out as well. I want to give Sydney a shout out. She is now an ACE, which is a certified economic developer through CalEd. So shout out to her. We continue to develop staff, making them better and hopefully making our community better. And last but not least is the homeless count. Will be taking the event on the January 27th. So for the community out there, this is a no volunteer event this year for COVID purposes. But if the community sees people out there milling about the homeless areas, they'll be out there counting and identifying homeless for the annual county homeless count. So just a heads up. And that's all I have to report.
Thank you. Anything else from the council? Thank you. City Clerk.
At this time, anyone wishing to comment on non-agendized items, please press star 9. I will announce the last 4 digits of your calling number when it is your turn to speak. Please state your name and eliminate any background noise. Individual speakers are limited to 3 minutes each. Please keep in mind, state law prohibits council from taking action on items not listed on the agenda, and your matter may be referred to the city manager. Please press star 9 at this time if you wish to comment on non-agendized matters. Caller with the last 3 digits, 7517. Please press star 6 to unmute yourself, and you may begin.
Well, hello, everyone there. I'm glad to see everyone safe and healthy and looking out for the city of Lancaster. My name is Paulette Dunn Sanders. I'm the founder and organizer of Stopping Pressure on Teens. My main concern was for the MLK Day. I had ran into a lot of residents out here in Lancaster that was wanting to celebrate his birthday, but many of the events were to serve. Absolutely nothing wrong with serving, but for a birthday, we want to also celebrate. So when COVID, if ever, was to calm down or we were ever to do something like that, maybe possibly next year, would like to get something like that put on the table and become organized with that so we can all come together and celebrate. Thank you.
Nice.
Yes, it would.
Thank you.
No other speakers have expressed a desire to speak at this time.
Thank you. Okay, I guess that's it. Unless anybody else has a burning desire to speak. The next meeting is scheduled for Tuesday, January 25, 2022 at 5 p.m. Hopefully it will be in person, but that's pretty much up to the virus, isn't it? Thank you all for coming. Thank you for all your hard work. Good night.
Good night. Thank you.
Night.